I'm from Catholic University School of Nursing, San Vincent of Paul. My name is Michelle Estefania Velez Ronquillo, and I'm going to talk about amaurosis fugax caused by a branched retinal artery embolus. Definition: amaurosis fugax is a condition in which a person loses sight in one eye. The loss of vision in the affected eye may be total or partial. It usually lasts just a few seconds or minutes, then it returns to normal. Occasionally, it may last for several hours. This is caused by interruption of blood flow to the artery that supplies blood to the retina.
This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about amaurosis fugax. AF means a loss of vision out of one eye. If you were diagnosed with AF, amaurosis fugax, then you should come back to the emergency room if your arms get weak, numb, or paralyzed, especially on one side. If you have vision loss, trouble speaking, or trouble thinking. If your chest hurts or you get short of breath. If your eye hurts, even if you can still see fine. If you have any other signs of temporal arteritis, as will be described later, or you have other concerns that weren't addressed during your first visit. Amaurosis fugax. It can be total or partial, and it is not permanent. It will go away. Another name is transient monocular blindness. Usually vision goes back to normal after a few seconds to a few minutes. Vision is often normal again by the time the person seeks medical attention. This can make it harder to find a cause. People who have had AF often say it was like a shade or a curtain came over my eye. Usually it happens because an artery that brings blood to the eye was blocked. This is called retinal artery. The blockage often happens because of blood clot or plaque. Small piece of cholesterol breaks off from the larger artery. It then travels to the eye. It gets trapped in the retinal artery. AF also happens when blood flow to one eye is low. Blood vessels bring blood to the eye. Blood flow can get low when one of them gets narrowed. When older patients get AF, it can be a sign of another serious problem, like giant cell arteritis. It also called temporal arteritis. It usually happens to older people more than 50 years of age. The blood vessels in the head and neck get inflamed. It can cause symptoms like AF. At first, vision problems may be temporary. However, it can make people go blind. This blindness may be permanent and not go away. Other symptoms of temporal arteritis are severe headache over the temple side of the head, is tenderness to palpation. You can almost see the temporal arteries in their temple. And vision problems. The jaw may also ache or hurt while chewing. If you have any of these symptoms, you must go to the emergency department right away. And for a detailed video about temporal arteritis, please see the video that corresponds to that on my channel, the ED Exit.
Causes: amaurosis fugax are caused by a loss of blood flow. This can be due to a buildup of cholesterol and fast plaque in the arteries of the heart. If some of that plaque comes off the artery and gets into the bloodstream, it can flow to the artery that supplies blood to the retina, blocking the flow of blood to the retina. When that happens, vision is lost for as long as the blood flow is interrupted. Symptoms: painless, sunless loss of vision in one eye. Visual loss is often from the top down, appearing like a curtain being pulled down over the field of vision. Rapid returns of vision. Vision generally comes back in a few minutes to several hours.
Amaurosis fugax, a symptom described as a shade coming down over the eye. A partial or complete loss of sight that is temporary. This temporary interference with vision is usually related to atherosclerosis in the blood vessels that supply the brain. It can also occur with excessive acceleration, as in flight. Amaurosis is the Greek word for darkening, dark, or obscured. The ancient to refer to dimmed vision, especially if there was nothing they could see that was wrong with the eye.
Applications in medicine. Typically, patients describe diminish of advanced vision in one eye that progresses over a few seconds and lasts for seconds to a few minutes. The impairment progressively may involve the entire visual field. The loss of vision usually begins in the upper field, less frequently in the periphery, and rarely in the lower field. Pros and cons. In many patients presenting with amaurosis fugax, the diagnosis will be established after the clinical or ophthalmologic examinations. The examinations may have uncovered dry eye syndromes, a posterior vitreous detachment, or some other ocular condition that has caused the transient visual disturbances. The eye care provider can manage this condition, but if the diagnosis has still not been established, further evaluation is warranted. Issues of light in Ecuador. Patients with amaurosis fugax are at risk for stroke, myocardial infarction, vision loss, and other serious consequences. A thorough case history, careful clinical and ocular examination, and appropriate system testing will lead to the best possible outcome for these at-risk patients.
Amaurosis fugax is a painless transient monocular visual loss. Pathophysiology and etiology. Prior to 1990, amaurosis fugax could, clinically, be divided into 4 identifiable symptom complexes, each with its underlying pathophysiology: embolic, hypoperfusion, angiospasm, and unknown. In 1990, the causes of amaurosis fugax were better refined by the Amaurosis fugax study group, which has defined 5 distinct classes of transient monocular blindness based on their supposed cause: embolic, hemodynamic, ocular, neurologic, and idiopathic. Concerning the pathology underlying these causes, some of the more frequent causes include atheromatosis disease of the internal carotid or ophthalmic artery, vasospasm, optic neuropathies, giant cell arteritis, angle closure glaucoma, increased intracranial pressure, orbital compressive disease, a Steele phenomenon, and blood hyperviscosity or hypercoagulability. Embolic and hemodynamic origin. With respect to embolic and hemodynamic causes, this transient monocular visual loss ultimately occurs due to a temporary reduction in retinal artery, ophthalmic artery, or ciliary artery blood flow, leading to a decrease in retinal circulation which, in turn, causes retinal hypoxia. While, most commonly, emboli causing amaurosis fugax are described as coming from an atherosclerotic carotid artery, any emboli arising from vasculature preceding the retinal artery, ophthalmic artery, or ciliary arteries may cause this transient monocular blindness. Atherosclerotic carotid artery, amaurosis fugax may present as a type of transient ischemic attack, during which an embolus unilaterally obstructs the lumen of the retinal artery or ophthalmic artery, causing a decrease in blood flow to the ipsilateral retina. The most common source of these atheromemboli is an atherosclerotic carotid artery. However, a severely atherosclerotic carotid artery may also cause amaurosis fugax due to its stenosis of blood flow, leading to ischemia when the retina is exposed to bright light. Unilateral visual loss in bright light may indicate ipsilateral carotid artery occlusive disease and may reflect the inability of borderline circulation to sustain the increased retinal metabolic activity associated with exposure to bright light. Atherosclerotic ophthalmic artery will present similarly to an atherosclerotic internal carotid artery. Cardiac emboli, thrombotic emboli arising from the heart may also cause luminal obstruction of the retinal, ophthalmic, and or ciliary arteries, causing decreased blood flow to the ipsilateral retina. Examples being those arising due to atrial fibrillation, valvular abnormalities including post-rheumatic valvular disease, mitral valve prolapse, and a bicuspid aortic valve, and atrial myxomas. Temporary vasospasm leading to decreased blood flow can be a cause of amaurosis fugax. Generally, these episodes are brief, lasting no longer than 5 minutes, and have been associated with exercise. These vasospastic episodes are not restricted to young and healthy individuals. Observations or where new diagnostic efforts may be made, a euro during which fluorescein angiography is an appropriate consideration. However, carotid angiography is not advisable in the presence of a normal ultrasound and CT. Treatment: if the diagnostic workup reveals a systemic disease process, directed therapies to treat that underlying etiology should be initiated. If the amaurosis fugax is caused by an atherosclerotic lesion, aspirin is indicated, and a carotid endarterectomy considered based on the location and grade of the stenosis. Generally, if the carotid artery is still patent, the greater the stenosis, the greater the indication for endarterectomy. Amaurosis fugax appears to be a particularly favorable indication for carotid endarterectomy. Left untreated, this event carries a high risk of stroke. After carotid endarterectomy, which has a low operative risk, there is a very low post-operative stroke rate. However, the rate of subsequent stroke after amaurosis is significantly less than after a hemispheric TIA, therefore there remains debate as to the precise indications for which a carotid endarterectomy should be performed. If the full diagnostic workup is completely normal, patient observation is recommended. Amaurosis fugax, treatment. See also, ocular ischemic syndrome. Amaurosis, hemianopsia, references.
Conclusion: amaurosis fugax occurring in the younger patient are probably associated with a more benign clinical course than that seen in older persons, and that migraine is a likely cause for the episode of visual loss in a majority of this group. Because of this, we believe that a conservative approach to the evaluation of such patients seems warranted. Thanks.